Hey guys, this month we're talking about pediatric orthotics, and this week in particular we're talking about SMOs, or supramalleolar orthoses. Hey guys, it's me, Dr. Nooreen, your resident foot and ankle specialist, and welcome back to my channel. So you guys, what is an SMO? An SMO is a supramalleolar orthoses. Simply put, it's a foot and ankle brace that is flexible and does not go very far up the ankle. Now this, you guys, is a very teeny tiny itty bitty one. So this would be like for a very, very young child. This is where their ankle would hit about. So it goes just that much above the ankle. So whenever I present an SMO as treatment for a child, the parents oftentimes have very similar questions or concerns. And they range from, what will my child's future look like? Is my child behind? What can I do to help? And I think one of the best things we can do, or parents can do, is to educate yourself. And I think those things will help understand what's going on with your child and where they are with their development and where they're likely to go. So when may your child need an SMO? So some reasons a child may need an SMO are overpronation, hypotonia, or hypermobility, gross motor skill delays, or toe walking. Now, to clarify, it is normal for a child under the age of about 5 or 6 to pronate, which basically means that the child is more flat-footed. And as they walk, their arch collapses a lot. When I'm deciding what a child needs, this is not the only factor I take into consideration. You have to look at all the factors. So overpronation by itself, or hypotonia by itself, or toe walking by itself doesn't necessarily mean your child needs an assistive device. You have to look at the whole picture of the whole child, the developmental history, and all of that. So one of the other things I mentioned that an SMO could be helpful in treating is hypotonia. What does hypotonia mean? Basically, hypotonia is low muscle tone. So even at rest, if you touch or pinch your muscles, they have a certain tension to them. And hypotonia is when that tension is low and the muscle will often feel too loose or too relaxed. Now, another thing to consider are delays in gross motor skills. If your child is older than 15 months and not walking independently, that's a reason to consider an SMO for treatment. And another factor to consider is toe walking, which is something else an SMO can help with. So when I'm evaluating a child, these are some of the factors that I'm thinking about. Taking into consideration these factors and the child as a whole is how I decide if the child would benefit from an SMO. So you guys, what does an SMO accomplish? So an SMO gives your child stability and structure while still allowing flexibility. Pretty mobile. So as your child develops, you want a child's foot to have movement and allow the bones to mature in a more flexible, not rigid environment. So something like an SMO will give your child's foot structure and stability where it will hold it in a corrected position, but still allow flexibility where the bones can still mature in a positive environment. And the other thing an SMO does is it uses circumferential compression. The heel is brought back into proper alignment, the arch is lifted and supported, and the toes are back in line with the foot. A question I get asked by parents a lot is, how long will my child need these? Now that varies from child to child and diagnosis to diagnosis. Some kids will just need one pair to get caught up with their peers, and some will have to go through multiple pairs. Okay guys, so I hope that answers some questions about SMOs, and I hope that if you are the parent of a child that needs an SMO, I hope that I answered some of your questions and potentially help ease some of the worries that you may have. And if you guys have additional questions, leave them in the comment section down below. And as always, you guys, thank you so much for watching. Don't forget to stretch and subscribe, like this video. I'll see you guys next week. Thank you. Bye.